Afternoon, everyone. My name is Nyasha Chingore, Programs Lead at the AIDS and Rights Alliance for Southern Africa. I would like to welcome everyone to this webinar on both platforms, those who are joining us on the Zoom and those who are joining us on the Facebook Live. Just to welcome you again to this third edition of this webinar series on advocating for sexual and reproductive health and rights and bodily autonomy and integrity using the Africa human rights systems. Once again, the AIDS and Rights Alliance for Southern Africa is a regional organization working with partners across 18 countries in East and Southern Africa. ARASA has a zero tolerance policy regarding bullying, derogatory language, sexism, homophobia, transphobia, etc. People who disrupt the meeting or display such behavior will be removed from this webinar and comments removed from the Facebook feed if inappropriate. This afternoon's webinar, as I've already mentioned, is being recorded and live streamed on Facebook. The recording will also be uploaded on the ARASA web YouTube channels afterwards for people to be able to rewatch or send on to colleagues who you might think this would also be useful for. So before we start, I will just take us through once more my last time doing this in the series, the background to why we're actually having this webinar series. And then I will introduce us to our lead facilitator and our panelists this afternoon. So at ARASA, we believe that the promotion and protection of human rights is critical to the successful realization of sexual and reproductive health and rights. That it is equally important for ensuring the ability of all of us to exercise complete agency over our bodies, free from external interference, social or legal sanctions, coercion, violence, and discrimination. We also believe that it is important, promotion of human rights is important to ensuring that we are well and have the right to be free from physical interference and touching without people's concerns, without our own consent. And the two things that I've just described is what we describe as bodily autonomy and bodily integrity. It is therefore essential that those working at the African level to promote sexual and reproductive health and rights and bodily autonomy are empowered to effectively engage with the African systems for the purposes of contributing towards the change in laws, policies, and eventually practices at national level. It is with this in mind that we at ARASA have decided to host this series of webinars and conversations to enable mostly ARASA partners and allies, but anyone else who is interested, to carry out effective advocacy at these levels. We, for the purposes of these webinars, have looked at the African Commission on Human and People's Rights, the African Committee of Experts on the Rights and Welfare of the Child, and today's webinar will be looking more broadly at the African Union Commission system. All these are important bodies for development of regional laws and standards and for the advancement of sexual reproductive health and rights and bodily autonomy and integrity. The aim of these webinars is to increase the capacity of partner organizations to advocate for SRHR and bodily autonomy and integrity using these African systems, using a human rights lens. And we are also aiming, we're also hoping that at the end of these conversations, partners will have an understanding of how to work with these bodies and how to advance whatever is presented from these bodies at national level to ensure that ultimately conversations at national level are influenced by the conversations that are happening at regional level and are taking into account any human rights standards that are created at this level. We would also like to clarify what we at ARASA mean and what we believe around bodily autonomy and integrity. I've already alluded to this in my introduction. But essentially, we believe that each of us as human beings with equal rights should have the agency of our own bodies, a bodily autonomy and integrity that is equal to all others. We recognize that lesbian, gay, bisexual, transgender, and intersex persons, sex workers, people who use drugs, people with disabilities, women, young people, and particularly young women, all deserve the same bodily autonomy and integrity as every other human being. And yet we recognize that all of them experience daily violations that make it impossible for them to live their lives of dignity and respect. And so really this is the purpose why we are having these conversations, the last one being this afternoon. Before I just move us further to the conversation and to introducing my wonderful moderator and panelists today, you can move on, Hijin, to the poll, please. I just wanted to do a very quick check-in with some of the participants. I see we do not have too many on the on Zoom today, but for those of us that are on the Zoom platform, just wanted to check in with you. How many of you have actually engaged with the African Union? And for the purposes of today, we are talking specifically engaged with the ADIS side of the African Union, so not the African Commission as we did 2 weeks ago, but kind of the political engagement and the diplomatic engagement. Okay, interesting. Like I said, not too many participants on my Zoom today, but I am seeing that of those that we do have, the majority have not really engaged with the African Union. And then the question around, do you think that the African Union is a useful tool or a useful space for advocating on sexual and reproductive health and rights? I'm glad to see that there is clear consensus on that one from everyone who has responded with an empathetic yes, definitely, not even an unsure about whether or not this would be potentially a useful space for advocating on SRHR. So thank you so much to those of you who have engaged in that quick poll. I now have the pleasure this afternoon of introducing us to our main facilitator and panelists for the afternoon. So it is my pleasure this afternoon again to introduce our main facilitator, Muluka Miti Drummond. I beg your pardon, Muluka. Muluka is a senior human rights consultant who has over 15 years experience working on human rights in a number of international and regional human rights organizations. Muluka has a specialization in human rights in Africa and in UN advocacy, and has extensive experience in conducting expert human rights research, including field research, producing reports, and in making submissions to human rights bodies, including African human rights bodies, the African Commission in particular, and supporting civil society organizations in doing this in various roles that Muluka has held. And also has experience in advocacy and campaigning and developing such materials. I think it is apt for us to just mention that Muluka has recently been appointed the UN Special Rapporteur on the rights of people living with albinism. And Muluka will take us through the first session of the webinar today and just give us a short presentation on the lay of the land as far as the AU is concerned, so that we are all just on the same plane in terms of you know, what that looks like. And then we'll take us into a conversation with our two wonderful panelists this afternoon, who I would like to now introduce and to thank the organizations that they are coming from, Athena and the SRHR Africa Trust, for their partnership with us on today's webinar and allowing us to learn from their experiences in engaging with the AUC and being so open to being vulnerable to share their lessons learned, where they have failed and where they have succeeded, and how they think we can better engage with these systems. So I will introduce firstly Catherine Nyambura, and Catherine, you can just switch on your camera for 2 seconds and say hello to everyone. Catherine is an international development expert who self-identifies as a Pan-African feminist. Her academic background is in biomedical research and public policy. Thank you, Catherine. She has worked on sexual and reproductive health and rights, women's rights, adolescent health, HIV prevention, care and treatment and research for over a decade now. Her work, born out of student activism, transitioned into community organizing and currently involves working across the intricate linkages between grassroots organizing, national, regional, and global advocacy, programming, and research. Catherine is the director of programs at Athena, as I mentioned earlier, and she really enjoys her role working with feminist networks, adolescent girls, young women, grassroots movements on global advocacy, global health advocacy, and feminist movement building across Africa. So thank you so much, Catherine, for making the time, and Athena for the partnership. The second panelist for today is Levi Singh, who works with the SRHR Africa Trust, as I mentioned earlier, as a regional youth and policy advisor. Levi is former Secretary General of the African Youth and Adolescent Network on Population and Development, AFRIAN. He now serves as a mentor to the current executive committee of the network. Levi works extensively on systems for the meaningful engagement and participation and leadership of young people in health policy making spaces, using data to influence policy dialogues through civil diplomacy. And he'll explain what that means to us when Levi starts talking later on. Levi's professional work and advocacy experience includes the Africa Agenda 2063, UN Sustainable Development Goals, Africa Health Strategy, the ICPD Program of Action, and universal health coverage with a focus on adolescent and young people's health and well-being. Levi is also a global advisor to the Global Health 50/50 initiative, which is housed at the University College of London and seeks to realize gender equality in the global health space. So I look forward to chatting. Well, Muluka will do the chatting and I will do some listening and potentially ask some questions to our two panelists today, because they've been really influential young people in terms of really taking space and advocating for issues within the Africa regional spaces. So we are really excited to have both of them today. Without further ado, from my end, I will now hand over to Muluka for the rest of the processes. Thanks, Muluka.
Thank you, Nyasha. I thought that as we were talking about the AU, I would just start by playing a little bit of the anthem. And I don't think I need to play all of it. I just thought I'll give us a little bit of a taste of what the AU anthem is like. I don't know if many of us have heard it. So that was a very, very short snippet of it. We talk about the African Union, and I'm sure many of you have heard about it. Some of you may have engaged with it. And aptly, we're talking about this as our third body, African regional body that we've been looking at in this series. So we've looked at the African Commission on Human and People's Rights and the African Committee of Experts on the Rights and Welfare of the Child. And we're culminating this with the African Union. When we talk about the African Union, we're obviously talking about the 55 country body, or organization of 55 countries in the continent, which seeks to promote peace, stability, and integration, among other things, regional integration, among other things. Part of the way that the African Union does this is to ensure, I will also share my slide. Part of the way that the African Union does this is through the development of common positions, policies, agendas, and guidelines for states. And most importantly, of late, I suppose many of you would have heard of Agenda 2063, or the Africa we want, as we refer to it. So Agenda 2063 is kind of Africa's answer to the SDGs. It's kind of similar to Africa's Sustainable Development Goals. And I think even it's important to start when we're talking about the policy framework to support work around sexual reproduction and health and rights, as well as bodily autonomy and integrity, to start with Agenda 2063. The agenda has a number of aspirations and goals, which are aimed at transforming Africa into a global powerhouse. Important for us is aspiration 1 on a prosperous Africa based on inclusive growth and sustainable development. And specifically, and aspiration 1 is goal 3 on healthy and nourished citizens, and specifically expanding access to quality healthcare services, particularly for women and girls. Then as well, aspiration 3 on an Africa of good governance, democracy, respect for human rights, justice, and the rule of law. So I just wanted to start with that, because I think it's always important to see how everything fits into Agenda 2063 and how we can use that in our work. As with the other sessions, I'm going to start looking at the relevant kind of policies, documents, declarations that have been adopted at AU level in relation to sexual reproductive and health rights, as well as body autonomy and integrity. I'm going to go through this quite quickly, as I know that I've put down quite a number of them here, and there may be others, but I picked out some of the ones that I thought were important in relation to this. Starting with the Abuja Declaration of 2001 and the frameworks and the declarations that have come out of that. So we have the Call for Accelerated Action in 2006 and the Abuja Declaration of 2013. And this Abuja Declaration is important because the first one, 2001, the states committed to present to 15% of the budget, they pledged to allocating 15% of their national budget to health, as well as steps towards ensuring eradication of HIV, AIDS, and other tuberculosis and other infectious diseases. The declaration also set up the AIDS Watch Africa, which is a body that many of you may have engaged with already, an AU statutory body. I will talk about it a bit more later. And also made a number of other commitments towards ending HIV, AIDS, tuberculosis, and malaria in Africa, including ensuring mobilization of resources, the protection of human rights, and undertook to strengthen and collaborate with CSOs in relation to this, which is quite important for us, that there's an undertaking by African Union, in other words, our governments, African states, to collaborate and network with civil society in relation to HIV, AIDS, particularly. In Abuja Declaration of 2013, there was also a strong commitment to ensuring relevant laws and policies at national and regional levels, as well as to strengthening a rights-based approach for protection of all vulnerable and key populations in countries, as well as to integrate sexual and reproductive health and rights into policies and practices. Related to this as well is a catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030. So it's a big kind of undertaking and aim. And this part of the aim of this framework is to intensify the implementation of the Abuja declarations that we've just referred to. So ensuring, particularly the 2013 Abuja plus 12, the 2013 declaration. So ensuring that the states are intensifying the implementation of this declaration. It looks at the existing standards and the existing targets and goals in the Sustainable Development Goals, as well as Agenda 2063, which I've referred to. And this framework also sees human rights, health as a human right, and it commits to ensuring equality and equity in healthcare, as well as ensuring that approaches to HIV/AIDS are evidence-informed approaches, and to overcoming any of the barriers to access and prevention in relation to AIDS, TB, and malaria. Now, what is quite interesting in these frameworks, where most of the frameworks will refer to vulnerable groups, but none of them specifically, as far as I know, I could see, none of them specifically mention LGBTI communities, although they do mention vulnerable groups. There are other relevant frameworks, documents, declarations, specifically in relation to sexual and reproductive health and rights. And I'm thinking particularly of like the Solomon Declaration on Equality in Africa. And this kind of also, this declaration also committed to the fight against HIV and AIDS, but not just that, also enabling women's full participation and launching a campaign to end gender-based violence. It looked at promoting and protecting all rights, human rights of women and girls. As part of this, states undertook to carry out regular reporting on the implementation of the Solomon Declaration on Gender Equality in Africa. And this undertaking is under Article 12. Something else that came out of this declaration is, again, something that's a platform that many of you have engaged with, the GMAC, Gender is My Agenda campaign, and the GMAC platform came out of the Solomon Declaration. Important to also mention is the Continental Policy Framework on Sexual and Reproductive Health Rights, which also had a number of undertakings and also reporting requirements. There's the Maputo Plan of Action of 2007, which was then reviewed and renewed in 2016 and will go up to 2030. We also have the Addis Ababa Declaration on Population and Development in Africa. I'm not going to go into all of them because I would want us to get to the panelists at some point. So I'm going to speed through that. I think it's also important for us to understand when we talk about the African Union, what is the African Union? What are the different structures of the African Union? And it can be a bit confusing at times because we hear so many different issues. So first of all, it's the Assembly, the African Union Assembly, which is basically it's a decision-making body, it's a supreme body. It's composed of all the presidents, kings, prime ministers who are heads of states and government. So this is composed of all the heads of states and government of the Assembly, sorry, of the African countries, and they are in the Assembly. We then have the Executive Council, which basically takes the decisions on policies, and it is composed of foreign ministers or any other minister that certain countries may think is appropriate or is at the same level as foreign ministers. We also have the STCs, the Specialized Technical Committees, which look at thematic, they're thematic committees and they look at different thematic areas. They are composed of ministers and other senior officials, not necessarily the foreign ministers, but other ministers or senior officials in government. The Permanent Representative Committee, or the PRC, are basically like the ambassadors. So these are like the country representatives who sit in at the African Union, so known as the ambassadors, and they represent the states on the ground. I have included some of the others here. The African Union Commission, I think, is the one that's quite important as well for us here. So it's the African Union Commission initiates all proposals and submits proposals to AU organs. It also looks at the implementation of decisions and provides support to states in implementing AU programs and also ensuring gender mainstreaming. The AU Commission is composed of a chairperson, who's the chief executive officer, and a deputy chairperson. And now there are 6 commissioners. There used to be 8 commissioners, but they're now 6 commissioners with different directorates. Most important, I think, for our purposes here is the one on health, humanitarian affairs, and social development. Our panelists will also tell us if they've engaged with other directorates. I guess also it might be a bit confusing because of the kind of changes. But under the Health, Humanitarian Affairs and Social Development Directorate, there are 4 divisions, and this includes health systems, disease, and nutrition as one, health and humanitarian affairs, the second one, labor, employment, and migration, as well as social welfare, vulnerable groups, and drug control. The division on health systems, disease, and nutrition are responsible for policy development and advocacy, coordination and monitoring and evaluation in relation to AIDS, TB, and malaria and other infectious diseases. Another body is ECOSOC, the Economic, Social and Cultural Council. I will look at that a bit more in detail when we look at how you can engage, how civil society can engage with the African Union. And I also want to refer to the African Court on Human and People's Rights, which we have not looked at in this series, but is also quite important. It's also seen as one of the judicial, human rights and legal organs, together with like the African Commission and the African Committee of Experts. Also important to mention is the Pan-African Parliament, and this is composed of parliamentarians which are selected by the legislatures in each country. And ideally, individuals should be able to kind of contribute to the African Union's policies and programs through engaging with their own representative of the Pan-African Parliament at national level. We'll look at that as well, a little bit in passing. So we've looked at some of these already, and I wanted to look at the Economic, Social and Cultural Council. The ECOSOC provides an opportunity for all African civil society organizations to contribute to the development of policies and programs. So ideally, this is the forum where civil society would be able to contribute to the development of the policies and programs that I've just referred to, and the campaigns as an example. It is actually composed of social and professional groupings from all over Africa, so from African Union member states. It consists of excuse me, I'm about to sneeze. No, I'm okay. Sorry. So it consists of 150 civil society organizations, and these civil society organizations have a 4-year mandate and can only be re-elected once, so they can only serve an 8-year term. So as you can see, space is limited when you consider how many countries there are in Africa and how many civil society organizations there are in the whole continent. So it is, there's a limited number of space for civil society organizations to be part of ECOSOC. And they're also quite specific on which civil society organization. So first of all, there can only be 2 CSOs from each member state, so 2 national CSOs. And so we're looking at about 110 CSOs from national states in total, 2 from each country. Then there are 10 CSOs that operate at regional level and 8 that operate at continental level. And then there are also 20 CSOs that are elected from the African diaspora. So organizations that are based outside of the continent, but of people of African descent, regardless of their citizenship, can form these CSOs that can take part of this. And then they also have 6 CSOs in ex officio capacity. So it will only, at national level, if you're a national organization, you have a chance of being there for an 8-year period, but you will have to be one of 2 CSOs. So it's quite hard to be part of the ECOSOC in this case, or to gain ECOSOC status, but that's one of the ways of possibly engaging. Another way is through getting AU accreditation. So non-governmental organizations and regional bodies can apply for observer status, as well as non-African countries. So most of us would have heard recently of Israel gaining observer status to the AU. And this provides opportunity to engage more with the African Union and the development of policies and programs. In order to get this AU accreditation, however, NGOs have to meet the requirements set out in the criteria, in the decision on the criteria for granting observer status and system of accreditation within the AU. There are a number of requirements set out in there. I've just highlighted a few, just for the sake of raising some of these. So first of all, the aims and purposes of an NGO seeking to get, excuse me, I've been waiting for that sneeze. So the aims so the NGO must have aims and objectives that are in line or in conformity with the African Union in order to get accreditation. Should also undertake to support the work of the African Union. And must have recognized standing. So these are definitely must have recognized standing in the particular field of competence. And the AU often encourages organizations working in similar areas to form a joint committee or other body so that they can be represented through this joint committee. Again, a limitation might be that for some organizations is that an organization must be registered in the member state and must have proof of at least 3 years, proof of 3 years, 3 years proof of registration, sorry. So for organizations, especially when we look at organizations dealing with sexual minorities that may not have been able to get be registered in their countries, this will present a kind of a problem or a barrier to achieving AU accreditation. The organization must also have an established headquarter and be in Africa and must be properly constituted and have a management with a majority of African citizens. Another potential barrier to obtaining AU accreditation is that at least 2/3 of all the resources of the organization must be derived from contributions of its member states. I say this as a possible barrier because we know that in many cases, organizations tend to get a lot of foreign funding and members may not be able to, even where there are members that are contributing to the resources of the organization, it's not always possible for 2/3 of the resources to come from the member states, from the members of that organization. And then another requirement is that the organization must not discriminate. So there's just requirements. So there are two possibilities. There's the AU, and actually there are more possibilities, but the ones that we've just referred to are ECOSOC status and AU accreditation. But other platforms for CSO engagement, so specifically in relation to AIDS, I've referred to AIDS Watch Africa, which is a statutory entity of the AU, and it's a platform for advocacy and mobilization, as well as holding states accountable for implementing actions in response to AIDS, TB, and malaria. AIDS Watch Africa also holds regular consultative expert committee meetings, and these are meetings of health experts from AU states, and they discuss issues in preventing any progress towards implementation of the various frameworks. The experts also prepare a report with key recommendations, which, the heads of states and government must consider in taking action. So one way of engaging is through the AIDS Watch. If engaging specifically in relation to AIDS, for example, is through AIDS Watch Africa, specifically the consultative expert committee meetings where civil society organizations have access to health experts and they can feed into that. The GMAC campaign, Gender is My Agenda campaign, also has organizations, and it's composed of 55 national and international organizations. And these organizations monitor the implementation of Solomon Declaration. The GMAC holds meetings biannually prior to the AU Assembly meeting, the AU Commission, the AU Summit. And so that's another, if one of the 55 civil society organizations, another avenue. The African Union has a Citizens and Diaspora Organization Directorate, CIDO, which consists of civil society and a diaspora division. So the civil society division is responsible for ensuring civil society engagement in all AU processes. And at the same time, the African Diaspora Division ensures the participation of people of African origin who are living outside the continent, but these do not have to have African citizenship anymore. So you may have African origin, but may not have African citizenship or citizenship of any African country, but can still engage through the African Diaspora Division. And then lastly, like, as I said, the Pan-African Parliament. So it would be useful to know who your member of parliament is, member of the Pan-African Parliament, your parliamentarian, and see whether you could contribute through the parliamentarian. Now, I've said a lot, and it can be quite confusing. And having said this, all the question may arise to, okay, how is it done practically? So I'm going to stop sharing right now. I'm decided not to do this part because we are I'm trying to get the best out of our participants, our panelists. So I'm going to stop sharing right now the slide and move over to our panelists. So Catherine and Levi, if you would please turn on your cameras for me. I'm going to spotlight and add a spotlight. Thank you both, Catherine and Levi, for attending and for being willing to provide your inputs. Before we go further, I suppose the first part would be for you guys to introduce yourselves and tell us a bit about your organizations and what your organization does before we go any further. So Catherine, would you mind starting, please?
Thank you so much, Muluka. I'm Catherine Nyambura. I'm with the Athena Network. Athena Network is a network of women's rights organizations, young feminist networks, and individuals as well from the continent, particularly focusing on Eastern and Southern Africa. And our focus and topical issue is HIV and AIDS and SRHR, with a particular focus on advocacy, working with at the national level, at the regional level, and globally as well. My primary engagement with the African Union has been both as part of my work at Athena now, but also previously in my role at Femnet, a Pan-African women's rights organization. So I look forward to sharing my experience working with some of the divisions you're sharing, Muluka, but also specifically the African Union Commission and engaging in some of the bodies you are outlining, like the summit and others. Over to you.
Great, thank you, Catherine. And Levi?
Thanks, Muluka. Hi, everyone. My name is Levi Singh, and it's a pleasure to join you all. I work with the SRHR Africa Trust based here in South Africa. The SRHR Africa Trust is a 31-year-old NGO based in South Africa. We work primarily on SRHR for adolescents and young people. Our big three impact areas are on improving access to SRHR services for adolescents and young people, strengthening the protective environment for adolescents and young people, as well as removing barriers that impede young people's access to SRHR services in its comprehensivity. And then lastly, the portfolio that I work mostly on is strengthening voice and leadership of adolescents and young people to engage in policy decision-making spaces that have an impact on their SRHR. I'll talk a bit about my experience now and also working as the Secretary General of AFRAN, which was mentioned in my bio, and some of the work that we've done there in terms of advancing adolescent and youth development issues, in particular SRHR, through the African Union Commission and its work.
Great, thank you. Thank you both and welcome. It's a pleasure to have you here both. So from my perspective, one of the ways of engaging initially is through the documents. So even if you can't engage with the bodies, there are these documents that can help in the work. And I've just mentioned some, but there's so many, there's a plethora of different documents that come out of the AU Commission. What use have you found them? Have you found them useful in your work, and how have you been able to engage with these documents? And specifically, which documents have you engaged with or used? So I think since I started with Catherine, I'll start with Levi this time.
Thanks, Muluka. Yeah, as you mentioned, there's a plethora of instruments at an activist and advocate's disposal, and it's quite the tedious process to understand which one to use in which spaces. I think it always helps to understand what the angle is you're pushing within the African Union space, and I think that the angle that we've particularly focused on over the last 3 years, especially with the momentum towards the Nairobi Summit and the global process around ICPD, was the Addis Declaration on Population Development. I think what's interesting around the AADPD is the fact that in 2018, when it was being reviewed for its first 5 years of implementation, we had reported around 50 out of 55 African Union member states submitting reports to the African Union Commission on progress with regards to the AADPD. It's also noteworthy that out of the 88 commitments within the AADPD, 26 are SRHR, gender, and adolescent and youth specific. So in terms of looking at progress or regression on SRHR, especially of adolescents and young people, the AADPD has been quite helpful and quite instructive. The other mechanism that we've found particularly helpful as well in terms of informal discussions with the regional economic commissions and member states directly has also been the demographic dividend roadmap. So in 2017, you had the African Union declare it as the year of the demographic dividend, and this spurred on a process where African Union member states came together with national youth councils and national youth bodies in particular to discuss the demographic dividend issue and the priorities that need to be considered in order for a demographic dividend to be realized, but also the investments that need to be made in order to accelerate any sort of attainment of this demographic dividend and the phenomenon that was occurring in terms of population dynamics. And I think there's a specific focus on SRHR that has been recommended to member states in terms of how member states need to invest in SRHR services, in removing harmful legislative and policy barriers that restrict adolescents and youth from maintaining their autonomy, but also accessing services so that they can manage their fertility and they can stay free of disease, free of violence, and really be empowered to make the decisions about their health. So the AADPD and the demographic dividend roadmap have been really, really helpful over the last 5 years. And one can't talk about SRHR in the AUC space without talking about the MPOA. So the Maputo Plan of Action version 2, we managed to secure at the end of 2015, early 2016. And this has really been the big roadmap at a meta level in terms of guiding our understanding of SRHR within the AUC space. But I think Catherine would maybe want to say more about the MPOA.
Great, thank you. Levi, you've mentioned a couple of things that I would like to come back to, but if I would like to hear Catherine as well. What documents have been useful for you in your work?
Thank you so much. And I will just pick up from the Maputo Plan of Action to pivot to the Maputo Protocol, the protocol to the rights of women. I think for me, what has been helpful in terms of having documents like the Maputo Protocol is how the African Union contextualizes and kind of domesticates for the continent normative standards of human rights for African governments. So one of the laudable things about the Maputo Protocol, it speaks of women's rights, gender across social, economic, cultural, and economic rights, and all of that. But the other most important bit is that it has been commented to have even higher level of standard and ambition compared to some of the other global policies that we know, right? And so I feel like when it comes to sexual reproductive health and rights, it is one of the documents that particularly speaks about reproductive rights, particularly outlines the scope of and benchmark and standard for African governments, for example, legislating on abortion rights. So it really has been a visionary document, so to speak. We fondly refer to it as the African Women Bill of Rights, right? And it's been an exciting document to have, and to think that years ago that African policymakers could come together and have this document for coming forward. And I think the other thing is, when it comes to gender responsive budgeting, it is one of the documents that outlines how to balance budgeting, for example, at the national level, and how to allocate funding for gender equality, which has been, it's been an outstanding advocacy issue for many women's rights organizations. And there's quite specific benchmarks and guidelines for how to do that. And so I'm excited for that. I think for me, Maputo Protocol has been an important document to be using as an SRHR advocate, as a HIV advocate. We do have challenges in terms of reporting. We do have governments and countries who have lots of reservations, but nevertheless, it's a document that's been born off the African soil, and we are really proud of. Secondly, is a solemn declaration on gender equality in Africa. I think for me, it was interesting to see a document like that, where there's a specific recognition of the feminization of the HIV epidemic. We rarely did not, most of the times, the gender space and the HIV policies there was no confluence, or there was no place where they were meeting. And the SDGA does provide a platform for that. The rigorous reporting and the platform through the GMAC does provide space for contributing and constant accountability and follow up on that. And then two others I'll speak about, the demographic dividend agenda, where I think at the beginning of the demographic dividend, it was devoid of a rights focus, right? There was this focus on population dynamics, rightfully so, that's important. I think at a time when youth advocates across the continent were ringing the bell on lack of representation and lack of equal access to opportunities and education and all of these other things. And so from our end, just articulating what it means to have a gender responsive demographic dividend agenda is an important point. How to make sure that as you discuss demographic dividend, you also infuse a rights-based approach to it, human rights, access to resources, and just continue to focus on that. And I think finally is the Abuja Declaration. I think we must agree that the ambition of setting what the African Union does for me and the space that I've seen is that the beyond providing norms and standards, there's quite clear guidelines as to, for example, budgeting on health. At a time when a lot of SRHR funding, HIV funding is coming from external funding, there's a clear guidelines and framework for how African governments can be, leveling up ambition for domestic resources and financing for HIV, for health generally. And I think that gives folks at the national level who are doing advocacy with their governments ways in which to infuse that level of standard in budget advocacy at the national level and push the needle much further as possible. So I think for me those documents are helpful, and we've also seen them being revised and even having high ambition as Levi is talking about the MPOA 2017-2030, and I think that those documents for me are great tools, but I also an illustration of the ambition that sometimes can come from engaging with the African Union when there is a technical discussion that's devoid of politics. We can speak about that much later in terms of how some of these documents set standards, but also they do have some pretty level-headed technical approaches in terms of norms and standards. Thank you.
So what's interesting for me is the level of excitement and engagement that you both have in responding to these questions and talking about these documents that seem quite, sorry, am I still on? Hello? Hello?
Yes, you are, Muluka.
I am, okay. It just seems to have gone frozen, so I wasn't sure if it was my end. But I was just saying, yes, so it's a level of excitement and engagement that you both speak about these documents that seem quite technical and a bit dry in some cases. And both of you talked about reporting. And I suppose many civil society organizations understand reporting in terms of the African Commission and the African Committee of Experts on the Rights and Welfare of the Child, and also in terms of treaties specifically, but not in relation to these frameworks and to these documents. So maybe if you could just talk us through what the process is and how you've engaged in the reporting processes, either under GMAC or the Abuja Declaration or any of the others that you have referred to. I'll start with Catherine this time around.
Thank you. So I'm just going to speak about reporting quickly for the State Department, for the Solemn Declaration on Gender Equality in Africa, the GMAC session that happens right before the African Union Summit every time. There's a report table in terms of how African governments are faring on in terms of implementing the articles of the Solemn Declaration on Gender Equality in Africa. And civil society are welcome to contribute to the national reports on that, but mostly what the GMAC does is it compiles the report and does rank countries as to how they're performing. In the recent past 3-4 years, there's been efforts to, for example, reward governments who are making progress and making strides. I think one of the complicated bits about some of these tools and instruments is that given that they're not necessarily structured in the treaty bodies kinds of mechanism, the reporting is very much in liaison with the African Union responsible directorate or the department or the division. For Maputo Protocol, one of the ways in which this was happening was through the African Commission on People and Human Rights, because the protocol is to the charter. However, the African Women's Decade, there was a report about the African Women's Decade and what that meant. So various society will take up the responsibility of collectively reporting on that in terms of how that's going. Make Every Man Count is one such organization, but also through platforms like Solidarity for African Women's Rights that I'm glad to share information on this. And I think the caveat I have here is that the ambition that's set is really great, but then there's fatigue of reporting from states. For example, from Maputo Protocol, I think the reporting rates are really less than probably 30%, and the reports are not on all, mostly don't cover all the articles, right? Particularly if governments have reservations, and it's not clear really what the reporting means. Do you provide recommendations or audits? There has been shadow reports. There's mechanisms and opportunities for civil society to submit shadow reports. I think that has been helpful in terms of vigilance, but also keeping up advocacy. That if you have Maputo Protocol over 15 years later, it's really important if all governments, for example, could ratify it. So could ratify it and ensure that we hold ourselves to high standards of guaranteeing access to sexual reproductive health and rights for everybody across the continent. So just briefly on that. And then finally is, I think the most important tool here is to be mindful of is reporting, particularly on these documents, really means society being in close contact and in close understanding of engagement with the various divisions and the directorates. So it won't be as periodical as the treaty body's reporting would look like. So I think that's a caveat I would like to wrap up with. Thank you.
Great, thanks. And Levi, I know you talked about reporting a lot. So if you could just tell us as well, walk us through the reporting that you have done under, whether it be the Addis Ababa declaration or the others, the dividend one. Yeah.
Thanks, Maluka. I think Catherine's raised some really pertinent points and covered a lot of the points that I wanted to talk about in terms of reporting. I think specifically with the AADPD one, we know that the AADPD will be reviewed every 5 years. So the next reporting cycle will be 2023. I think it was really interesting for us in terms of the SRHR community is to look at the windows of opportunity that emerge around these reporting cycles. So for the AADPD, we knew this was being linked to the global process around the Nairobi summit and around the ICPD at 25. And there was quite stellar leadership also displayed by UNFPA and especially the African Union Liaison Office in terms of feeding civil society information, keeping everyone quite abreast of what is going on. I think there was also some great leadership from the Division on Health, Population and Drug Control in terms of the role that they had played in terms of ensuring that there was adequate civil society participation at the final review meeting in Ghana in 2018. But I think what was the most standout for me was how there were opportunities for civil society to actually impact the report. So for instance, I work personally on the South African side, working with the 3 respective ministries who were compiling the report from South Africa on behalf of the member state to the AADPD. And it was really quite an interesting and complex and dynamic process to see how 5 ministries, so your Ministry of Health, your Ministry of Education, your Ministry of Social Development, your Ministry of Foreign Affairs, and let's say the Ministry of Youth would converge on one report, but there will be one single ministry in the form of your Ministry of Population Affairs or Ministry of Foreign Affairs who would be coordinating the entire process and really finding the allies within that space to engage on some of the content and to really slip in and contribute meaningfully towards the development of the report in terms of providing data or alternative arguments that could be presented in the report. In terms of a civil society space, I see that we have colleague Chantal Musa, who's also on the call. I know she'll jump in terms of giving an overview maybe at some point around the experience from civil society in really engaging with the AADPD reporting process and the development of the civil society statement. But that was really an interesting process. But I think it's just, yeah, what Catherine said is important. It's to understand, the roles that the respective divisions and directorates play, how to access these divisions and directorates. I think what we found really helpful was gaining access to the AUC handbook, which is often popularized at the start of every year. The AUC handbook usually has all the meetings that are forecasted for the year, at least if it will suggest the months that these meetings will happen in for the various commissions and for the various political processes at the African Union. The handbook is quite instructive and quite useful if you want to keep a finger on the pulse of what's going on within the African Union. It also gives you an idea of the dynamics politically, so who's chairing, who's outgoing chair, who's incoming chair, which member states are making up the bureau. So if your member state is maybe on the bureau or chairing, you know that you already have an in terms of engaging with your Ministry of Foreign Affairs or the respective ministry aligned to that process to really find out, what's the pathway for civil society participation, looking at opportunities around national consultations. So for South Africa and the ADPD, there were around 2 national consultations that had occurred, and then the feedback from civil society was consolidated into the member state report, and that was then presented on behalf of the member state and civil society. But in most countries, it's not that easy. However, there is a process, and it usually is really prudent and helpful to understand what the dynamics are and who's where in order to trigger a process and gain more information and move things along at a national level.
Sorry, it would help if I spoke with my microphone on. So both of you have spoken about the importance of working with different directorates and different individuals within the AU, and I guess obtaining knowledge as well from them, information from them about what's coming, as well as information from the AUC handbook. When it comes to working with directorates, I see there's so many, working with AU bodies and the directorates and the divisions and, the different bodies, I refer to some of them, and there's so many, and it can be so murky and opaque and confusing for many individuals. What bodies have you worked with specifically, that you've worked with specifically that you found useful in your line of work? And I'm thinking of Catherine, maybe if we can go to you.
Thank you so much. I had to change my position. My chat is going down. I hope you can still see me. So I have primarily engaged with the Gender Directorate, and I think it's been very helpful, especially as you prepare for the summit. Generally, every year you have a different theme for the African Union, and the theme then informs the agenda of the African Union summit. And so the Directorate of Gender has the mandate and the responsibility of looking at the gender aspect of whatever theme it is. For example, if it's the gender, if it's the demographic dividend, if it's food security, if it's human rights, whatever the point is in terms of whatever the discussion is in terms of topic and focus. And so every summit, it's important to understand how women's rights organization, how feminist networks can be engaging and plugging into the summit agenda, for example, whether there is opportunity to be featuring in terms of panels. And so I think beyond the reporting formally in terms of these tools, also just continuously informing the agenda and the engagements at the African Union is important when engaging with the directorate. And in this case, if you're working on women's rights and SRHR and others, the Gender Directorate becomes the focus for that. And in other instances, there are reports being tabled on various issues. So sometimes, if it's the issue of the African Women's Decade, sometimes there are reports being put forward. If there are strategies being approved, as you spoke about, how do you plug into that? So that's one. And the youth division is the other one, where as a demographic dividend roadmap was being put in place, there was lots of consultations at the national level. So and the division was designing what those are. Oftentimes there are also expert meetings that happen. You spoke about the STCs, but also there are expert meetings on various issues. So there will be expert meetings on the demographic dividend. There are technical discussions, and in many instances, civil society organizations are welcome to engage in those ones as observers, but sometimes to have a substantive contribution, whether it's presenting a report or it's presenting experiences from the programming and technical experience that people have gathered. And so the youth division does work closely with youth-focused organizations, youth-serving organizations, and does create space for engagement in that way. And then finally, for me, is the health division, the health division in terms of SRHR. So, for example, at the revision of the documents in 2016, as the MPOA was being revised, there was quite a series of consultations on the catalytic framework, on the current version of the MPOA that we do have. And so I think those spaces, those divisions will, beyond the handbook that you've seen, there will be quite a bit of meetings, of meetings that may become technical, so they may not be necessarily be featured in the formal handbook, but they'll be important in terms of getting the agenda done. Mm-hmm. And before things get to the ministerial place, there is a lot of technical work that has been put into that. And so it's important to also be plugging into those discussions. They are often more rigorous. They're often more of those, and there will be ministerial meetings. So it's critical to be mindful and to understand how best to contribute to that. And in instances, for example, with meetings like CSW, the global one, it's a global meeting that happens every year. The African Union does host an expert segment for that, a ministerial segment for that, which is how you get the Common African Agenda. And so I think those divisions for me have been helpful, especially when engaging with the women's rights agenda on the continent, the SRHR and the HIV agenda as well. Over to you.
So I think it's quite interesting. Levi, I don't know, have you engaged with different directorates or bodies? Maybe you can add on to that to see, what has been most useful in your work.
No, it's usually the same ones that Catherine had listed in terms of the Health, Population, Drug Control Division, as well as the Youth Division. I think those two have been most central in terms of engaging and really being able to permeate and access some of the spaces for influence. I think Catherine's point on really paying attention to the technical meetings can't be overstated. When the meetings get to the ministerial level and when they become, specialized technical committees, there's very little room to influence, and 70% of text is already decided and discussed. I think it's the technical committees that we have to look out for, because it seems that the technical experts are more attuned to what is going on in respective countries, especially like the population development experts. They're really a lot more amenable to conversation and to learning, rather than getting sucked up into the politics and the diplomacy of things that usually play out in the multilateral fora. So I think that's a really key point of information. Look out for the expert meetings.
So this is quite interesting. I mean, both of you talk about working with the directorates, looking out for the expert meetings. And I think for organizations that have never engaged on this level, never engaged with the AU, this just seems like an impossible task. It's like grow wings and fly. So, practically speaking, what tips would you give for organizations that have never engaged with any of the directorates? But where do they start? How do they contact the directorates? How do they find out about the expert meetings beyond? Because I think you talked about the AUC handbook, but at the same time, Catherine has mentioned that the expert meetings will not necessarily be in the AUC handbook. So maybe let's start by my first question. How do you even get in touch with the directorates? How will we, practically speaking, for an organization that's never done this work before, where do they start?
I'll jump in. So I think there's three starting points. So the first one is start with an engagement with your Ministry of Foreign Affairs. Don't go straight to directorates. Try reaching out to someone at your Ministry of Foreign Affairs. It's very important to build rapport with your Ministry of Foreign Affairs. They're very difficult to access in many cases, but persist, build rapport, build relationships, and that would be a first entry point. The second entry point, I would say, would be your UNFPA country office. So your UNFPA country office or your UNFPA regional office will have some sort of connection to the AU liaison office of the UNFPA. They are often on the pulse when it comes to meetings and processes for civil society engagement, and often they do work very closely with their country offices to facilitate engagement, especially of young people in continental policy processes. The third recommendation would then be, if you fail at the Ministry of Foreign Affairs, or if the UNFPA is maybe being unresponsive, reach out to the AU Youth Division. In my experience, they're very responsive, they're very amenable, especially if you are a youth-led or youth-serving civil society organization working in the plethora of SRHR agenda. they're very interested to see how they can assist and how they can link you to the right and the relevant people. And since most of our engagement during the last 18 months has been virtual, it has been quite interesting to see how spaces that would usually be shrunk and usually would be quite cliquish have actually opened up to some newer faces and to newer organizations, especially grassroots ones. So I definitely think this is an opportune moment to build networks, to build bridges, to get people connected and to make the circle bigger. But I'd start in one of those three places, yeah.
So great, thanks. Those great tips, starting with your Minister of Foreign Affairs, the UNFPA, and the Youth Division. Catherine, what was your entry level like? How did you enter the impenetrable corridors of the AU?
I think I have a different route, and I think that's the easiest, especially for civil society organizations. Oftentimes, on different issue areas and topics, there are civil society umbrella organizations or platforms that you could plug into. For example, the GMAC platform is a civil society organization platform that's coordinated by a secretariat and often puts out calls for applications, people to engage. So you don't need to know anybody at the African Union. You just need to know when the meeting is happening or keep an eye out for that and plug into that. And once you access that space, you will be able to learn, much more with a much less stressful pace how the African Union works. You'll be able to, for example, contribute to collective position statements or on various women's rights issues. And the agenda is often 2 days. And I have seen a lot of grassroots organization, new faces come on and take space and be able to plug into the GMAC spaces. There are other membership organizations like Femnet who do coordinate their members to engage with the African Union much more formally. And on issues, for example, like SRHR, we have seen organizations like IPPF who have an African Union liaison office do create pathways for CSOs to contribute. So we do have a lot of organizations who do have CSOs who have African Union liaison offices. We have IPPF, we have Save the Children, we do have Plan and many others who have specific staff who are based in Addis or whose work is just to follow the proceedings of the African Union. And that's really a way for you to just get an in. And then afterwards, you probably will be able to find your way and network with the relevant division folks at the African Union. I started with my first entry point to the African Union was through my work at Femnet, where I used to work, and I was coordinating quite a bit, a lot of engagement of adolescent girls and young women, contribution and engagement in those spaces. So I think the CSO route is the easiest. It's less stressful, and then also beyond the Ministry of Foreign Affairs, I think there are other ways for you to join your government delegation. If people are having a meeting, for example, oftentimes if you go to a meeting as a civil society, you're an observer, but if you're part of your delegation, then you have, you're able to formally engage and contribute without the limitations of being an observer. So sometimes you could ask for accreditation as part of your government delegation. It happens at the UN, but also the African Union sometimes allows that. And that means that if you have been consulting and if you have a robust agenda that's shared and co-created, you'll be able to engage much more meaningfully. So I do, in addition to what Levi has said, I think those are some of the other two ways and avenues that could be direct and quite specific to engage with the African Union.
Great, thank you.
And so finally, I think finally also I've seen folks have MOUs with specific departments and divisions. That's the most encouraged way, especially if engaging the African Union is a clear mandate or a very it's one of the strongest focus in terms of your programming. So I have seen divisions being open to MOUs with CSOs, of course, much later after engagement for a long time.
Great, I think this is very useful. It's quite good to have these practical on the grounds kind of tips that CSOs can follow. And I think, Catherine, what you've referred to about umbrella bodies and networks of CSOs and being involved with them, this kind of resonates with what has come up when we've discussed the African Commission and the African Committee of Experts on the Rights and Welfare of the Child. So it's quite important for civil society organizations to also understand this. But also one of the things that has come out quite more clearly here is that as civil society organizations, we, especially human rights organizations, we tend to focus a lot on the human rights aspect and the Human Rights Commission and the Committee of Experts and those commissioners, and we forget the political aspect. And I think both Catherine and Levi, you're bringing out the idea of the engaging with the states, engaging with what we often consider as political bodies, whether it's the Minister of Foreign Affairs or going as kind of a delegate, accredited delegate of the state. And these are areas that we often do not consider as human rights organizations. So it's quite good that that's coming out and working with AU liaison bodies and UNFPAs and things like that. So it's quite useful for us to have that. Levi, I wanted to go back to one of the things that you said. You said, I think specifically, we managed to get Maputo Plan of Action extended or something to that extent, which shows a lot of ownership in that process. So maybe if you could talk us through, like when you talk about how we managed to get it extended, what kind of role that you played in that, and yeah, your engagement in relation to that.
Thanks, Maluka. So there was the previous iteration of the MPOA until 2014, if I believe, and then there was the African Union, which had the idea to extend the MPOA, and this was also falling in that time frame where we were moving from the MDGs to the SDGs. So at a very high level, politically speaking, there were thoughts around, the unfinished business and what needs to be shone a spotlight on in order to get the African region into levels of development that hasn't necessarily been attained through previous frameworks and agreements. So I was with AFRIAN and as a Secretary General when we were negotiating around the Addis Declaration, the MPOA, and we had started from ground zero in terms of receiving the first draft of the MPOA extension. It came through our Ministry of Foreign Affairs and our population unit at the Ministry of Social Development in South Africa. And we had a robust unpacking nationally. So there was a national consultation. I was first acquainted with the MPOA when South Africa was discussing its first attempt at a national SRHR strategy, which primarily looked at adolescent and youth SRHR, and this then became the adolescent and youth SRHR strategy rather for the years 2015 to 2020. But you really saw how the things that South Africa had committed to as part of the MPOA and the first edition of the MPOA had trickled into informing a piece of policy and a framework for the South African government. So that was my first interface. But in terms of the actual extension process, so as I said, the draft came through. We had a consultation with the leads who were negotiating on behalf of the South African government. And we got to put some proposals on the table in terms of where language should be strengthened. So for instance, we had looked at language around comprehensive sexuality education and the importance of this language being reflected as a means to attaining gender equality. We looked at issues around age of consent, especially to SRH services. At this time in South Africa, it was still very difficult for a young person to access a condom in school or in a school uniform, yet we were reporting to be implementing comprehensive sexuality education in schools. So we brought up some of these contradictions in consultation with our respective government colleagues. And then we ended up in the Addis process. The Addis process was first a technical meeting. And the technical meeting really revolved around the text. And by the time we all got to Addis, there was a consolidated text that had come through with the inputs from the respective member states that had submitted inputs. And there was a very robust engagement. And it was an interesting time as well because the North African states were really pushing issues around migration, and they were like, no, we should look at issues solely around migration rather than just SRHR, and we don't have time to talk about fertility management and all these other things. So it was really it really opened up my mind and my mind to thinking. I think 19 years old then. So it really changed and shifted my way of thinking as an activist and advocate. And this is where I also came upon the concept of civic diplomacy and as how as citizens and as people who come from states with constitutions, we have a duty to be guided by our values, our constitutional values at that, and really to engage with member states, the African Union and other multilateral institutions unapologetically to really pursue these rights and the values that underpin many of these rights. So yeah, I think we took ownership of the MPOA and the first iteration, we really wanted to see that extended and we really wanted to see many of the calls that young people from across the African continent had made find expression in the MPOA. We didn't walk away with everything that we had wanted to walk away with, but we did walk away with a text that is quite aspirational and quite visionary and does lend quite the ambitious vision in terms of guiding African member states and civil society organizations in what we would consider to be comprehensive SRHR for Africans.
Great, thank you. I just want to clarify one point again, sorry. You talked about how you engaged on the national level, and then you said we ended up in the Addis Ababa process. How exactly did you end up in the Addis Ababa process?
So the details for the technical meeting were sent through to the member states. So the South African government was invited. They hosted another consultation before they went over to Addis. And then through our partnership with the SRHR Africa Trust at that time, we were afforded the opportunity to attend the session as an observer. So the SRHR Africa Trust had resourced AfriAN to come in and attend the session and to ensure that there was adequate representation. So as an observer.
Great, thank you so much. Catherine, can I just go over to you? And while I add Catherine, I'm going to add another panel member. I'm going to try and add Chantel to the panel. But Catherine, I know you have to leave soon. So before you leave, I just wanted to ask from you, what have been the challenges of working with the African Union from your point of view? I know you've talked about how you've managed to cooperate with them, but what have been the specific challenges that you've had? I'm now frozen and I'm not sure if it's me or if it's Catherine.
It's Catherine Moluka.
Oh, Catherine is frozen. Okay. Since Catherine is frozen, when you unfreeze Catherine, please do jump in. Maybe Catherine, if you are trying to speak, could you unmute, please?
I think one is that, as you've mentioned, given that when you're working with the African Union Commission, can you hear me?
Yes, we can hear you.
Yeah.
Yes, Catherine, please do continue.
All right. Okay. Thank you. So I was going to. Thank you. One is the fact that when engaging the African Union Commission, it's pretty much based on goodwill.
I'm sorry, Catherine. I think we are having problems getting through to you. There seems to be a connection problem. We can try again later, but I also know that you're leaving soon. I just wanted to convey, if you can hear me, one of the requests that came from the participants, asked if you could please write the name of the platforms you talked about to get information and the agenda. So if you can provide that. If you are able to connect again, please do step in, because we know you're leaving soon and we would like to hear some final words. While we wait for Catherine to do that, I also want to add Chantel to the panel. Chantel, if you could please turn on your camera and just introduce yourself. Levi has referred to Chantel a couple of times. So if Chantel, if you could turn on your camera and just introduce yourself to everyone, please.
Hi, Muluka. Thanks for adding me. Sorry, I'm not able to turn on my video now, but I'm happy to just add brief comments on the discussion. I've had the pleasure to work both with Catherine and Levi over many years in the African Union and the United Nations, doing advocacy both on SRHR, women's rights, and gender equality issues. And I really think they've covered a lot in terms of engagement and like navigating the politics at the African Union. Myself, I've had the pleasure to work with many different directorates of the African Union, including the Youth Division as
Have we lost Chantel?
Hi.
Chantel? We'll wait for...
Or dating on the gender policy, where we're invited as different experts in this field to provide input. So in addition to what they've said, really the African Union and the different directorates have enough, more than enough in terms of documents and policies and legal frameworks that really many people can engage with in their different contexts without having to directly, be there. If you are, that would be an added advantage. But what remains a challenge really is how to understand how you can work at national level, but also link and connect at the global and regional levels at the same time. Like any other intergovernmental space at the African Union, there are power dynamics. And I wanted to add that because we can just imagine that this is the African Union, this is the entity, and sometimes, I hear most of my colleagues talk about the frustrations, why isn't the African Union doing ABCD? But we also have to keep in mind that, this is an intergovernmental space in terms of how power and decisions are made. We also have to understand where they come from. So myself coming as a feminist activist coming from Rwanda, I've also had to educate myself in terms of what is the position of Rwanda in different spaces and on different issues before I get the African Union. What is the priority there and here? Sometimes, for example, Rwanda might not be able to speak at, for example, issues around SRHR, but it does not mean that back at the country level, they're not really doing a lot of progressive work on ground. And so this has to do with geopolitics and power dynamics in different intergovernmental spaces and different states' priorities. So I think in addition to what they shared, I also wanted to add that what is key for me, what has been like a learning lesson for me is to first and foremost understand your country context, your country politics, the different ministries and key people in ministries that are really have the power to, in terms of like adding content or like, for example, pushing in terms of resource allocation to different issues that we advocate for. Who are those key people, and understanding them and getting closer to them, I think has been really crucial, even before you get the African Union or the United Nations, to really understand how and where you can contribute. Because sometimes if you don't understand this background, or which countries, for example, leading in terms of power and decision making at the African Union, we can get frustrated. So I think that is also very key to understand. Through my experience, I know how South Africa, for example, Egypt, for example, and some of countries like Libya can have like more of an influence when it comes to decision making and issues at the African Union. Nigeria, not forgetting Nigeria, of course. But like, how do you get there, and how do you ensure that you understand these dynamics and not just get frustrated, but also understand your country's politics at the same time is also really relevant. Thank you.
Thank you. So understanding the country's dynamics and just the geopolitics around it and other politics. And I think that was kind of something similar to what Catherine was going to say, or I mean, Catherine was talking about the challenges that they've had, that she's had working with the African Union. So Catherine, I believe you're back on and you will be able to answer.
Can you hear me now?
Yes.
Thank you. I was going to mention two challenges. I think for me, the first challenge is that a lot of the success of advocacy at the African Union is also based on the staffers and colleagues who who are at the divisions and the directorates. So often when there's staff change, it means that you have to, not go back to square one, but start again with the relationship building, and that often takes time. I think that's the lay of the land in terms of how advocacy happens. But if a change of leadership happens, it means that you have to reestablish and reignite the trust that you've been building, and that can be a challenge if you don't have so much resources as an institution. And I think secondly is, while we laud the ambitious documents we keep seeing, but often when the technical process has to often, balance the political process. And that means that we end up with the least common denominator in terms of policy outcomes and policy declarations, because I mean, all 55 African governments do have to be agreeing on what we have as a standard. Increasingly in the past few years, as we have seen pushback and we've seen much more regression on human rights, we have seen language weaken, and we have seen also opposition start to emerge at the African Union meetings, where we didn't often used to see these kinds of dynamics and push back on what would not have been contentious issues, quote unquote contentious, and I don't think any issue is contentious, but we do start to see pushback on SRHR, pushback on women's rights, and I think that's frustrating, but I still think that the African Union hasn't gotten as much pushback as it's seen at the global level. So there's still hope there. And finally is resources. I mean, most grassroots organizations will not have the resources to be engaging the AU the way really you need to be engaging to get good results, right? So I think that leaves a lot of INGOs do having the biggest say at the African Union. And that's not to say that it's not okay, but we need to start seeing a lot more indigenous, more, national organizations do having a say and do influencing the agenda of the African Union. So I think for me, those three things are important to note. Thank you so much. And I also have to leave now. I do appreciate and look forward to listening to the rest of the meeting.
Great. Thank you, Catherine. Thank you for attending and for your time. It's a pity you have to leave right now, but thank you. Thank you for attending. Levi, you've been quiet for a bit. We're coming back to you. Chantal, if you could please stay with us for a little bit longer as well. Maybe you can help with the next question because it kind of relates to that. But before I go on to the next question, Levi, to give you a chance, what have been the challenges that you have seen at the AU level?
Thanks, Maluka. I think Catherine has succinctly covered the headline challenges. I think the only one that I would have to add to that is the lack of authoritative guidance that is given from the AUC to member states and regional economic commissions in terms of how to go about implementing many of these things that come out of the AUC ecosystem. So for instance, and from our understanding, in most cases, you need a parliamentary process that will be initiated that goes on to then institutionalize a protocol and look at the domestication of relevant policy instruments and the like. And I think the recent uncertainty and the recent hesitancy around reforms at the Pan-African Parliament, for instance, is indicative of how dire the state of guidance and cohesion is when it comes to African policy making and legislative consistency. So I really think that we have a profound challenge, and I don't have any bright ideas just yet on how we go about solving these. But this is why I say it's always good to build that national rapport with national ministries and national institutions before you go off to Addis, and then look at what are the opportunities to come back from Addis with whatever you've got signed, and to look at how that is aimed to be domesticated in your context. Because often when we do speak to our legislators and policymakers in our context, the question is, okay, now how do we go about this? If it's a strategy, it's quite simple. So for instance, when it was the MPOA literally just had obligations for the Department of Social Development, which has a mandate on SRHR issues. So the technocrats at the Department of Social Development picked up the MPOA, they paged through it, and they're like, okay, this aligns to our national legislative frameworks. This is what we're already doing at a policy framework. This is the window of opportunity of what we need to go influence Parliament on. But when it's stuff that's more statutory, or when it's a protocol, yeah, you really do need Parliament involved in the domestication of the language.
Great, thank you. Thank you for that. It's very good to get these insights to help people understand and strategize. A question that we have posed to panelists from the beginning, because our first session was on the African Commission, is in relation to the balancing of, and I guess this is something that Chantal spoke to, but just maybe to elaborate a bit more on it, balancing African values with some of the human rights principles, or an alleged balancing, you know, a perception of the need to balance African values with some of the human rights related to sexual and reproductive and health rights, as well as bodily autonomy and integrity. This question came from our first panel in relation to the observer status of cows at the African Commission, and how the AU Executive Council kind of demanded that be removed, and on the basis of the objects of the organization were not in line with African values. So from your point of view, your perspective, what kind of challenges have you had any challenges? And if so, how would you counter this argument of balancing African values and ensuring sexual and reproductive and health rights? Both questions to both Chantal and Levi, and that will... Chantal, maybe if we can start with you.
Thank you so much. This is a very tricky question. I don't know how to answer this without being really biased, but technically, just taking from the fact that where we coming from when we're talking about the instruments or the human rights and policy instruments that we have at the African Union, they do not exist in space. They were not just handed over from the global or the North to the African Union. Most of these documents are documents that African leaders have gone through process by process, whether it be from the technical working groups or the ministerial groups that go through these things and really decide what they think is fit and should be put in place in the African context. So yes, we do learn a lot from the global spaces, but obviously we also take into consideration that African state and African states are also members of the United Nations, and are also part of the global space where we talk about human rights and human rights being universal. So coming from that, I think yes, we do learn and also try to align most of our policies, not only SRHR, but other women's rights issues, but also rights in general, with these fundamental principles of human rights that should be applicable to everybody. So it is not only the African continent or other contexts that can claim to have special cultural or traditional values that needs to be taken into consideration. This is always an ongoing debate. But for me, I think like it does, like when it comes to implementation discussion of these issues, it can happen, or we can have these discussions with also take into consideration some of the concerns of different people, be it the member states or different citizens of the continent in general. But at the same time, for me, I always like that we need to be guided by at least basically by the human rights principles that we have, on issues around ensuring that there's no discrimination. I think, for example, you talked about in the presentation you're making, ensuring that we have policies and ways of ensuring engagement, civic spaces that are also are not coming from individual or certain groups' biases or concerns, but that make sure that there is inclusivity, but there's diversity, but there's also ensuring that there's no discrimination of anyone on the continent. So I think for me, balancing this is to always go back to what guides us, to what unites us as human beings, as Africans. Learning a lot from the Ubuntu. I am, because you are continent that are not principles, for example. So I think these discussions are ongoing and they always happen all the time. They're also influenced to a large extent by the different geopolitical issues that I talked about earlier. So it is part and parcel of what we do in terms of advocacy, but at least we try as much as possible to ensure that, let's at least take from the basic principles of human beings.
Thank you, Chantal. And I know it's a pretty tricky question, especially because we've just abducted you from the participants and put you in the panelists. So thank you for, for accommodating us there and responding. And Levi, over to you. Good to hear your input on the issue.
Thanks, Maluka. I think Chantal was really succinct in her response. And I think for me, it comes down to, again, the principle of Ubuntu, the established norms and standards that are within the African Charter, and how those find expression. I think when I talk from the South African perspective, in terms of how we interact on delegations and the like, we're informed by our national position, we're informed by our foreign policy, and our foreign policy is informed by our constitution. I think it was our foreign ministry and some of the civil society colleagues in South Africa that actually extended solidarity and did question, the decision around CAL. But this is just an indication of how hostile African spaces can be to progressive civil society. This raises age-old question around, well, not age-old because it makes me sound really old and I'm only 26, but it raises questions around, where do you balance rights and development, and how much rights do you need to ensure that development happens, and how much development can happen in conditions of constrained rights. And there's always that seesaw that we see play out within the African Union space. However, we keep chipping away. But in terms of finding balance, I think we often need to go back to our constitutions. We need to go back to our Bill of Rights, and we need to see where are the gray areas in our Bill of Rights that we can bend to forward our agenda. I think I'm going to say something completely different than this topic, but I think what Catherine had brought to our awareness as well before she jumped off, around the opposition permeating spaces, especially African Union spaces now, is definitely a threat. It's an undermining as well of our own sovereignty as Africans. You're seeing, I think it was Open Democracy that indicated that there's around $220 million worth of global North funding, especially from America and Europe, that has come into and through the African Union space and directed at respective regional economic commissions, specifically looking at countering issues of termination of pregnancy, comprehensive sexuality education, LGBTQI rights. So these are things we need to be aware of. But I think African instruments are also helpful here. So for instance, in South Africa last year, there was a real pushback against comprehensive sexuality education. Made the press and people were up in arms. There was the usual rhetoric around no, CSC is a Western position. This is something that the UN is trying to enforce upon us. This is an agenda being pushed by the IPPFs of the world. But due to our work on the MPOA and the fight for language on CSC on the MPOA that was actually endorsed and affirmed, we actually got to say that, listen, we've got an African instrument that was agreed as far back as like 2007 that talks about comprehensive sexuality education. The MPOA was endorsed, or the first edition of the MPOA was endorsed under His Excellency, the late Robert Mugabe. And if he had any hints of, external interference in African Union processes, he would have shut that down. But we got this. Now we really do stand by what's in these documents, and we push for progress. So I think on one hand, there is a lot of doom and gloom in terms of, space for civic participation within the African Union, especially for progressive civil society. But on the other hand, we do have some of these instruments that have some real good ambition that we can use both domestically, regionally, and continentally to uphold our own agenda.
Thank you very much. I think you did not divert, actually. You did answer the question in a very good way, I think. It's good to hear from both of you on the question of values, African values, and human rights, and the so-called, or the way that people see them as conflicting. And I think both of you brought out very important issue on or point about the documents, the treaties, the Maputo Protocol, the African Charter, and the other policy documents, the Maputo Plan of Action, and other policy frameworks and documents, which basically are now kind of bringing together what African values are. This is a commitment by states, commitment by our governments, and they bring together in a way what the values are, and those values include equality, include sexual and reproductive and health rights, and so they're not necessarily against the values of the country, of the continent, or African values. I think it was also very useful to speak to all of you all, and just the tips that you gave in ensuring that we don't ignore the political side. As I said, as human rights activists, we often ignore the political side unless we're criticizing it. But it is also important to understand how we can sometimes work with political sides and political bodies and inputting into political spaces as well. So that was quite useful tips that came out of this whole discussion. And I think one of the things that was repeated time and time again was the need to build rapport, build networks, build relationships, rebuild, and strengthen those relationships with African Union bodies. And it's hard to do that in the comfort of our offices, although now with Zoom, there's a little bit more possibility of that. So it was very good to just get these inputs that we cannot necessarily find just theoretically, but it's to get it from the inputs and the discussions that we've had here. Thank you very much both. Thank you, Levi, for your participation and your willingness to participate and to share your experiences. Chantal, thank you for being a willing abductee and agreeing to be included in the panel, in the panelists at very, very last minute notice. We've definitely benefited from your inputs. I will end at this point and hand over to Nyasha. Thank you again.
Thank you so much, Muluka. And thank you so much again to Levi and the SRHR Trust, Africa Trust, to Catherine, who has left us, and Athena, and as Muluka said, to you, Chantal, good to see you again after a bit of a while, or rather good to hear your voice. Thank you so much for your additional inputs into this. I am just quickly checking my chat. No, we did not have additional questions, but what I am definitely seeing from the stream is that there was a lot of appreciation for the session. I certainly did. I know that the first time we had a conversation with Levi about the conversation that we were having today, I learned so much. And I learned so much today as well. I do not want to regurgitate anything, save to just really appreciate your input, your expertise, your experience in this sector, and to just say, of course, should any of our partners, want to know more and we are a little bit confused, we will reach out to you and ask you to hold our hands as needed as we go forward in these spaces. So I have nothing more, save to just say thank you for being part of the series. We have committed that we will be sending Muluka's presentations to folk if you would like them. But of course, the recording will be on the Arasa YouTube channel, so you can disseminate it or watch it again if you need to. Other than that, because there is no upcoming one next week, I think we actually can close. Hejin, do you want to just quickly put up the poll? The closing evaluation poll. We do invite you to just fill that in and let us know whether you think that this webinar was useful well, also where you heard about it. So next time we know how to help people access this information, and definitely do reach out should you have, have any further questions for ourselves or for our panelists. and we will be able to assist in that regard. So good afternoon. Most of the people I think who are watching is afternoon and evening further. And thank you for joining the webinar. Bye.